Global Health Summit G20, we must vaccinate the world quickly. Participation of about 20 heads of state and government and 12 international organizations were carried out in virtual form at the Global Health Summit G20 held in Villa Pamphilj in Rome, Italy, on Friday, May 21, 2021. The COVID-19 pandemic has underlined the extraordinary importance of international cooperation. To this issue, the Global Health Summit G20 addressed the way forward in healing the world through vaccinations. Leaders around the globe committed to funds and vaccine donations to address the health and economic impact of the coronavirus. The Global Health Summit was chaired by Italy Prime Minister Mario Draghi and the President of the EU Commission, Ursula von der Leyen. The summit was conceived as an opportunity for the G20 and all invited leaders, virtually, to share the lessons learned in the current pandemic to improve responses to future health crises. Said Draghi, "We must vaccinate the world and do it quickly." The pandemic has underlined the extraordinary importance of international cooperation. With the participants from scientists, doctors, philanthropists, and economists, we will understand what went wrong. The Italy PM went on to say, "I would like to thank the group of scientific experts, and in particular the organizing co-chairs, Professor Silvio Brusaferro and Professor Peter Pio. Your report has provided essential guidance for our deliberations and, in particular, for the Rome Declaration that we will present today. I would also like to thank the over 100 non-governmental and civil society organizations that took part in the consultation held in April in collaboration with Civil 20. It is essential to allow the free flow of vaccine raw materials across borders. The EU has exported about 200 million doses. All states must do the same. There must be a balance in exports to those poorer countries. We must lift the generalized export bans, especially in the poorest countries. Unfortunately, many countries cannot afford to pay for these vaccines. We also need to help low-income countries, including Africa, to produce their own vaccines. We will probably need more vaccination courses in the future, and increasing production is essential. One proposal is to introduce a patent suspension on COVID-19 vaccines. Italy is open to this idea in a targeted way, limited in time, and which does not jeopardize the incentive to innovate for pharmaceutical companies. But this proposal does not guarantee that low-income countries will actually be able to produce their own vaccines. We have to support them financially and with specialized skills. European Commission President Ursula von der Leyen said, "The aim of the summit is to ensure vaccines for all, to bring the pandemic under control everywhere, to ensure that vaccines are given to everyone, everywhere, through exports but also by sharing production capacity." She announced 100 million doses to low-middle-income countries by 2021. According to the European Commission President, the logic behind this summit is to transform this year's experience into a sustainable solution for the future, saying it should become a new annual forum for health policies that bring global players together. In the Rome Declaration that concluded at the Global Health Summit, we will all commit ourselves to investing in health and health professionals, explained Ursula von der Leyen, recalling, the health workers who have worked tirelessly, saved lives, and who have committed, even when there was nothing more to do. The first lesson I learned from the pandemic, underlined President von der Leyen, is how much we need each other and how much the rulers have to work with scientists, experts, health workers, pharmaceutical companies, and certainly with civil society. We must never forget the scientific community. If we have reached satisfactory results today, we owe a hope to men and women who have dedicated their lives to science. France President Emmanuel Macron said in a video speech, "We will give at least 30 million doses of vaccines to the COVAX program, the global mechanism for providing vaccines to poor countries, by the end of 2021. Chinese President Xi Jinping announced, China will provide an additional $3 billion in aid over the next 3 years to support the COVID response and economic recovery in developing countries. We have already supplied 300 million doses of the vaccine to the world, and China will continue to do so to the best of its ability." The Director General of the International Monetary Fund (IMF), Kristalina Georgieva, proposed a $50 billion plan to end the pandemic, stating, "There can be an end to the economic crisis without an end to the health crisis. Ending the pandemic is a solvable problem but requires further coordinated global action. The world doesn't have to experience the pain of another COVID case jump. With strong global action hours and little funding versus benefits, we can get out of this financial crisis." Rebuilding travel.